Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Brad White. We're glad you joined us. Before we begin, I'd like to thank our sponsors, Altman Health Systems, Studio Arts and Glass, and Genure Appraisals and Liquidations. Today, Paul and I are broadcasting from our administrative offices, and our guest is Dr. Nicholas Sherock with myOBGYN and your best kept secret aesthetics. Good morning and welcome to the show, Doctor.
Hi, Brad. Hi, Paul. Hey, it's an honor to be here. Thanks for having me.
Dr. Nicholas Sherock has been providing compassionate medical care for women since 1994. Having completed his Doctor of Osteopathy degree from Ohio University College of Osteopathic Medicine in 1989, Dr. Sherock then went to do a one-year osteopathic internship at Doctors in Stark County. His residency in obstetrics and gynecology was earned during 1990 through 1994. Upon completing his residency, Dr. Sherock entered into practice in Canton, Ohio with Atrium OBGYN, where he was a partner for 15 years. He decided to transition to his solo practice in Orrville, Ohio in October 2010. In early part of 2015, Dr. Sherock, along with Rochelle Thompson, certified nurse practitioner, CNM, formed myOBGYN. Today, he has offices in Massillon and Orrville, employs a second midwife, Olivia Brewer, as well as 3 nurse practitioners, Carrie Akers, Megan Ledbetter, and Taylor Kettering. myOBGYN has offices in both Massillon and Orrville. Dr. Sherock offers routine gynecologic and obstetrical care, as well as having expertise in aesthetic medicine. His open-minded approach offers everything from Botox to water births, and he has developed an excellent reputation for minimally invasive surgery and has sought out the single incision laparoscopic hysterectomies, as well as other minimally invasive options. He is open to complementary medical therapies and often combines his traditional and alternative choices for many of his eligible patients. We'd like to remind our listeners today that our program is available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe. Dr. Sherock, welcome to the show. Please introduce yourself and tell our listeners a little bit about yourself, your background and training, and your practices.
Hi, Brad. I grew up around the Youngstown area in a small town called Girard. Graduated from high school there, and then went on to Youngstown State University, where I received my bachelor's in chemistry. From there, I went to Ohio University College of Osteopathic Medicine and received my Doctor of Osteopathy, my DO degree. And that is what brought me to Stark County. My clinical rotations were at Doctors Hospital, Stark County, that was in Perry Township years ago. And I stayed there to do a one-year osteopathic internship, and then went on to do a 4-year residency in OBGYN at SUMA Akron City. From there, I joined Atrium OBGYN, and was there for several years before I decided to go out on my own. Over the years, the practice has grown. I work with an awesome group of people, very proud of my staff, very proud of all of our nurse practitioners that help with all the care of the patients that we deal with and that we appreciate coming to our practice to see us. We only do surgeries and deliveries at Altman Orrville Hospital, which is a small critical access hospital in Orrville, Ohio. It's owned by Altman, and basically we've loved it there.
Excellent. Can you tell our listeners what aesthetic procedures are and which ones you do?
Yeah, so the aesthetic procedures are things that people want to have done in order to improve their appearance. The mainstay of what we do is Botox and fillers, which are injections that have to be done on a periodic basis to improve lines and wrinkles and just the contour of the face. We also do some skin tightening procedures with radio frequency. We offer a treatment called ThermiTite. We also do a radio frequency treatment called Thermiva, which is for vaginal rejuvenation and for helping with urinary incontinence. We do some laser, like laser hair removal and intense pulse light treatment to help with skin pigmentation issues. It gives us a nice variety, and we've had a lot of positive success with that.
How did you decide to do aesthetics in addition to OBGYN? You are a very busy doctor, by the way.
Yeah, we do keep busy. So interestingly enough, this kind of stemmed from when I was in practice at Atrium. There was some timing where patients were asking more and more for things like laser hair removal, and they were getting Botox procedures, and they were asking us for places to go and whether or not it worked. And we actually looked into it and decided to buy a laser hair removal unit that also offered things like intense pulse light. When we were doing that, we hired an esthetician that was helping us with those procedures. And after a while, she goes, all this laser hair stuff is really good, but what you should get into is Botox. And I thought to myself, Botox,
Okay.
I'm like, why in the world would I want to do Botox? And she goes, well, it's the up and coming thing, and this was, 20 years ago. And, and we went, and myself and a couple of my partners, we went and got trained to do Botox, and we started doing that. And interestingly enough, it very quickly, I realized that I wasn't treating people's wrinkles. What I was doing was I was treating their self-esteem, and that part of my practice became very gratifying.
Interesting. Why did you become an OBGYN physician?
Well, whenever you go through your different rotations, and whenever I was at Doctor's Hospital in Stark County, I quickly learned that whenever you're at that point in time in your career, that you're either a thinker or a doer. And I really felt I was more of a doer, and I really gravitated towards more of the surgical specialties. And OBGYN had a very interesting mix of surgery and medicine, and an interesting mix of being in the hospital and being in the office. And it was overall a very happy part of medicine. So instead of dealing with situations where people were sick and dying, we were dealing with young, healthy people that were at the beginning of starting their family. And that's what attracted me.
Interesting.
All right. Well, then how about this? How did you become interested in bioidentical hormones?
So when you're a resident, especially at a hospital like Akron City, the vast majority of patients that we dealt with on a day-to-day basis were young pregnant girls, and there was very little there was a very small population of people who actually needed hormone replacement therapy. But we learned about it through residency, and I spent time. Matter of fact, at one point in time, I was interested in becoming a reproductive endocrinologist, and I really enjoyed the time that I spent with Dr. Spiritos in Akron. Whenever I went through residency, you're basically taught, if a woman has a uterus, you give her Premarin and Provera. And if she doesn't have a uterus, you give her Premarin. And I go into practice, and I'm seeing more and more people that have hormone related perimenopausal and menopausal issues. And I put into practice what I learned, and I realized, this works for some people, but not for most. And I really thought there's got to be something else out there. And after a few years of being at Atrium, I decided to go and take my first course on bioidentical hormones. And I thought, boy, this is really a different world. There's a different way of thinking. Being an osteopath, we're taught to be open-minded, and whenever I started learning about bioidentical hormones, I felt, there's definitely some stuff here that really can benefit my patients. So whenever I brought that back to Atrium, there was kind of some mixed emotions about it, and I didn't really pursue a whole lot of it.
Mm.
Whenever I went into practice on my own, then we had the opportunity to really kind of go the direction that we wanted to go, and I started seeing more um, uh, patients with desires for bioidentical hormones, uh, and uh, and that just kind of grew from there.
Okay, doctor, it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to a pharmacist about our new Health Matters Drug Savings Program. We want to help you stay well and save money.
All right, doctor, before the commercial break, we were talking about how you became exposed and more interested in bioidentical hormones. How did that evolve in your practice over time?
Well, uh, so we were doing more and more of that, uh, um, and at one point in time, well, there's a physician, a colleague who is down the New Philadelphia area, Dr. Pakovich, and
Mm.
he had a very large practice associated with bioidentical hormones, and that's all that he saw. Well,
Mm.
at the age of 80, he developed some health issues and had to close his practice abruptly. And Randy, his office manager, gave me a call one day and said, "Hey, would you mind if we use you as a reference to send some people to get their hormones continued?" And I said, "Hey, that's no problem." I said, we'd be happy to see him." Well, little did I know that the response was going to be absolutely overwhelming. And
That's
bioidentical hormones right now are probably the largest part of our practice,
mm.
not only from the patients that came from Dr. Pakovich's practice, but from their referrals and their referrals. So it is,
Mm.
once again, a very gratifying part of my practice.
Excellent. So how about this? Do men go to see a gynecologist?
In my practice, they do. We all have hormones. Women make testosterone as well as estrogen and progesterone, and guys, they make testosterone, but they also make estrogen and progesterone too. So we're not a whole lot different. We are different in some of the ratios and some of the free hormones that's circulating in us. Whenever we started offering pellet therapy in my practice, I was trained to treat men. I, as an osteopath and going through a general osteopathic internship, I also treated men and felt very comfortable seeing them. They didn't feel comfortable seeing me. They get very nervous going to the gynecologist for the first time.
Well,
Okay.
but all right.
Once
So,
they get there, it's good.
well, it is, and you're a good guy, so hey, it's all about being open-minded. Maybe that's an extra way of breaking down the barriers of not sharing what's really going on with us men who sometimes
Right,
think we're too tough and too important to look for help.
right.
Don't be too tough. Um, but can you talk a little bit about what hormone optimization is?
Yeah, so that's where we really try to balance and optimize people's hormones levels. It's interesting because in the bioidentical world, I've really been taught and trained that we're really looking for improving the way that patients feel and improving their health and their vitality, and that doesn't always mean treating the numbers. And I remember very early in medical school that doctors saying, you want to treat your patient, you want to treat the lab values, and that's something that I've been able to continue, especially through this practice of bioidentical hormones. And we really try to help people feel their best without having side effects. And we do monitor their numbers to keep them safe.
Hmm. What about okay, men have different problems, okay, than women, obviously. prostate issues. Um, have you targeted prostate swelling in any way with hormone replacement therapy for men?
I- Yeah, interestingly enough, um, one of the culprits associated with prostate swelling has more to do with estrogen in men than it does with testosterone. And so we really try to optimize men's testosterone. Uh, and we also very closely watch their estrogen to make sure that it's not unreasonably high. We're monitoring their blood counts and things like that. Guys have a tendency to sometimes make more red blood cells when they're getting testosterone. So we watch that really closely, and we make sure that we're doing everything we can to promote uh, their muscle strength, their motivation. Guys are interesting because they start making less and less testosterone right around the age of 30, and every year that level just goes down. And guys, they cycle their hormones about every 3 days, whereas women are cycling their hormones about every 28 days. So what a guy experiences is a lot more subtle than what a woman notices whenever she goes through menopause.
Early in my career, um, for prostate swelling or whatever, they were using diethylstilbestrol, and now it's been kicked off the human world, I think, and only used for animals. So I'm told.
Right.
But we dispensed a ton of that stuff
Yeah.
back in the early days of my career. So did it work?
Years ago, it did. The problem with it was that it was also being prescribed to women for certain issues, and they found that it actually created problems with the developing fetus when women were exposed in pregnancy, and that was the biggest reason that it came off the market.
Yeah, I don't remember the women being prescribed that product, but it's been a long time ago,
Yeah.
like what, 30, 40 years ago or something like that. The diethyl was really in play.
Yeah.
So,
And that was before my time.
oh, okay. Was not before mine. I guess I've been around longer than you.
Yes.
Okay. All right. So, would you explain the Women's Health Initiative findings?
Yeah, so that was actually a very large study that was funded by the NIH, the National Institutes of Health, and it involved about 160,000 women. And they wanted to look at some of the potential health benefits or the risks and the benefits of hormone replacement therapy in healthy women. And the average age of well, it was kind of interesting because if women had hormonal issues, if they had menopausal symptoms, they actually weren't a candidate for the study. They were really trying to find the ability to have a treatment arm as well as a placebo arm. And if you had menopausal symptoms and you got in the treatment arm, you knew it because you felt better. So they really limited who could actually get in the study. And what they found was that in the first year or two, that there was actually an increased risk of things like heart attacks and strokes and blood clots. And then after a period of about 5 years, they found that there was a slight increase in risk that they said was almost statistically significant in breast cancer. And at that point in time, they felt that the risks were not as great as the benefits, and they stopped the study. Since that time, we've been able to know a lot about what went on and why some of those things have changed. They really only looked at two hormones, the first one being Premarin, and Premarin gets its name from where it comes from, which is pregnant mare's urine. And it contains a bunch of different estrogens, and only a very small percentage of that is bioidentical.
Hmm.
And then Provera is known as medroxyprogesterone, and medroxyprogesterone is also not. It is a chemically modified progesterone. It is not progesterone at all. It's known as a progestin. And the reason that they chemically modify it is, number one, to be able to put a patent on it, but also to make it stronger so that they don't have to use as much. And it was, and the findings were that in those women that were on the Premarin and Provera, that after 5 years they had an increase in the risk of of breast cancer. There was a group of women that was just on the Premarin alone, the estrogen by itself, and they actually had a decrease in the risk of breast cancer. So here we are 20 years later, and we found a lot of the reasoning behind why some of this stuff went on. And I really believe that the pendulum towards encouraging hormone replacement therapy is swinging the other way. And we are seeing that there are significant benefits, especially in women that start hormones early in their life.
Wow. Okay, it's time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning we are talking with Dr. Nicholas Sherock with myOBGYN and your best kept secret, aesthetics. So did we finish this subject, Doctor? Women's Health Initiative findings?
Yeah, like I said, that study was kind of prematurely ended, but nowadays, like I said, we have found that there were definitely some reasons and some understanding now as to why some of those things occurred. For instance, estrogen taken orally kicks off some metabolites that actually help soften plaques within the arteries. And as you start to soften those plaques, they begin to break off, and it increases the risk of heart attacks, strokes, and blood clots and pulmonary embolisms. And we have found over time that it appears that topical administration of hormones or subcuticular administration of hormones does not seem to alter those clotting factors. So we found out a lot of good things about what went on with the WHI to help. And whenever we looked at those findings, it really changed a lot with medicine. But a lot of the people that were in the bioidentical world looked at that and thought, well, that isn't what we prescribe. And we don't see those kind of things that go on with our patients. But it did change.
Anybody prescribing Premarin anymore? I mean,
believe it or not, there still are some practitioners that do still prescribe Premarin.
My God, we used to buy that product in 5,000 bottles years ago, and it just everybody in the world, a dog and a cat, and everybody took it. So it was just really amazing.
Well, it did help menopausal symptoms like hot flashes and night sweats and things like that.
Mm-hmm. Just amazing.
So are bioidentical hormones really natural hormones?
Not really. Interestingly enough, the only way to get bioidentical hormones is to take them from human beings. And since we can't do that, most of these bioidentical hormones come from yam, where they take a basic molecular structure for a hormone, and then they process it in the lab to make sure that it is chemically and molecularly identical to what it is your body makes. So that's why they're called bioidentical or human identical hormones.
So how have views on hormones changed over time? Do you have anything else to add on that subject?
Oh yeah, because a lot, over time, a lot of women got scared about taking hormones. A lot of prescribers got scared about prescribing it. A lot of medical institutions backed off from teaching about it. And the trouble is that over that 20-year period, we have a whole generation of providers that really don't understand much about it, don't believe in it. Matter of fact, many are against it. But like I said, we're starting to see this pendulum swing back the other way because we found that, especially with early initiation of hormone replacement therapy, especially estrogens, that it decreases the risk of heart disease. Women don't really develop heart disease until they go through menopause. It's
Mm.
pretty unusual when they do. And and once they do go through menopause, estrogen seems to be protective against the development of those plaques inside the arteries. Uh, 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 Human identical progesterone also seems to relax arteries, whereas medroxyprogesterone that was used in the WHI actually causes vasospasm. So there are certainly some big differences between bioidentical hormone replacement therapy and what is available commercially. And there's still a lot of medroxyprogesterone still being prescribed.
So why don't we touch on the differences between bioidentical hormones and the hormones that are commercially available?
So with bioidentical hormones, we use a lot of compounding pharmacies. And the reason that we do that is we're able to make very small adjustments in the doses, whereas what you can get in the regular drugstores from the big pharma companies, they're all pretty set in what the doses are, and you don't have very many choices. Now, interestingly enough, some of what you can get in a regular pharmacy is um, bioidentical. For instance, estradiol, or you can get micronized progesterone. Uh, but once again, you're very limited as far as the options.
Yeah, and sometimes to your point, especially with the progesterone that's commercially available, if you have a peanut allergy, you got to be concerned with that because they pack it in peanut oil. So it's always good to ask questions of your provider and your pharmacy to make sure you're fully informed because you know, can't tell you how many patients I've had ask me, well, what do you mean there's peanuts in this? My kid's allergic to peanuts. I mean, I don't think I am, but you just never know. So
Right,
it's a very fair question.
right.
Um, so let's talk a little bit more about compounding pharmacies. We're clearly proud of our facility. We just got done investing a significant amount of money building out our new facility in New Philadelphia. And it's something that we hope is going to help provide patients a level of care that for the coming years that's going to be really exciting. So what else do you like about the customizing from a compounded dosage form?
Well, number one, it's definitely more patient specific because compounding pharmacies have the ability to make very small changes in medications, and it's really the only place that you can find some of these different compounds. Like you can't find commercially available testosterone for women, yet testosterone is a very important hormone in women. Uh, uh, One of the other things that you can't find in a regular drugstore is low dose naltrexone. And I know that you guys are big proponents of low dose naltrexone, and so
It's
am I,
amazing.
because it really helps people, especially with some autoimmune issues. Um, so, uh, and I thoroughly believe that the people in the compounding pharmacies offer just a different level of education for their patients. Uh, in the big pharmacies, they're filling prescriptions every 45 to 60 seconds, and they just don't have that same ability to explain things to patients like my patients receive from the pharmacists that they talk to at their compounding pharmacies.
Well, I appreciate that comment. And I will tell you that it is, in my opinion, a more rewarding patient, pharmacist, and even provider experience when we can all work together to find solutions for patients. And I think that's what's exciting as a compounding pharmacy and a compounding pharmacist. Whether it be a child that was just born in the NICU at Akron Children's, or a man or a woman who's looking to try to help solve some hormone problems, or even your little pet, your Fido that needs something. I mean, it's really exciting to be able to customize solutions for people that are desperate for a solution. But let's talk some more about the world of gynecology. There's got to be new technologies and new things you're excited about in gynecology. Do you want to touch on some points there?
Yeah, one of the things that I'm really passionate about is what's known as V-Notes surgery, and V-Notes stands for Vaginal Natural Orifice Transluminal Endoscopic Surgery, which is why we call it V-Notes. And V-Notes is really, it's laparoscopic surgery through the vagina. Yeah, I have been always mindful about aesthetics in medicine. And as I have developed techniques to become more minimally invasive over the years, I moved from traditional laparoscopic hysterectomies to then single incision laparoscopic hysterectomies, because I felt that women liked having one incision rather than 3 or 4. And I never really ventured towards robotic type hysterectomies, because it basically requires 5 incisions across the upper abdomen, as opposed to 1 that I was doing. And then whenever V-Notes came along, I could find out that I could do surgery with no visible incisions. And the thing that blew me away about that was that women felt better quicker. The vast majority of my patients are able to go home the same day as having their hysterectomy. And I've had people call me the day after surgery and say, "Hey, I work from home. I feel fine. Can I just go back to work?" And I'd say, "Yeah, absolutely."
Wow.
I've had people who don't work at home, who have jobs where they have to go to their job, and it may be just involving paperwork and things like that. I've had people call me after 5 days and say, "Is it okay if I go back to work?" And you just do not see that with other forms of hysterectomy.
Well, the robotics seems to be moving into all sorts of surgery, and I guess I don't know how to ask this question, because I don't want to aggravate anybody else, but what's the big deal here?
Well, robotics is quite heavily marketed. It is very expensive. Those robots nowadays are costing upwards of $2 million each. And there's a lot of maintenance associated with them too. It costs several $1,000s just to open a pack to start to do a robotics surgery. And to me, I looked at that, and I personally, like I said, I've never trained on robotics. I've never really even been approached by anybody about training on robotics, because I think they knew that I had a lot of success with the minimally invasive stuff that I did. And there's a big push towards robotics, because the hospitals really, they want to keep their numbers up with regards to the robotic cases, because they are expensive to keep. And whenever we talk about moving forward in medicine, we always talk about sustainability. And it costs thousands and thousands of dollars to move forward with a robotic case. But with this V-Notes platform that I utilize, the device that I utilize to place in the vagina to do that surgery only costs about $800. And the instruments that I use are much less expensive than what has to be used with the robot.
Okay.
There are some great applications of robots, but but like I said, there's differences.
Gotcha. Okay, our last break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Thanks for joining us today. Let's get back to the last segment of the show. And we don't have much time left, so where do we want to go here?
We got about 7-8 minutes. So
Do you? Okay.
yeah.
So did we cover this? What is a VNOTES procedure? Are we done?
Yeah, the American College of Gynecologists has for years talked about vaginal hysterectomy being the best route for women.
Mhm.
And over the years, with the involvement of some of the laparoscopic hysterectomies, the traditional laparoscopic hysterectomies that makes incisions on the abdomen, and the robotic hysterectomies, we've really gotten away from a lot of the vaginal type surgery. And this is really a great way. There's myself and many other surgeons are really catching on to this and developing this more and more and more. I've been fortunate enough to go out and actually teach other surgeons in other areas. Matter of fact, I'm going to New York City next week to teach at Columbia University, along with several other colleagues, about teaching people about this surgery and how to incorporate it into their practice.
So why do we do surgeries this way? Is there?
Yeah, well, there's a lot of reasons why. Mainly is the recovery is quicker and faster, and it's more comfortable. An incision on the abdomen tends to be more uncomfortable, just because there's so much movement associated with the abdomen. But whenever the only incision that you make is between the vagina and the cervix, uh, afterwards people just feel very well very quickly. And it's unusual when they don't.
So for years we've done it through the abdomen. Is that correct?
Years ago, matter of fact, when I trained, at that point in time, we really, it was right when laparoscopic hysterectomy was just coming into its own. And during my residency, we strived as residents to learn surgeries and to be experienced with different ways of doing surgery. Um, and I remember whenever I was a senior resident, we really strived to make sure that a third of our surgeries were abdominal, a third of our surgeries were vaginal, and a third of our surgeries were laparoscopic. And over time, we've just seen more and more people kind of shy away from vaginal surgery. But this really has made a difference as far as trying to bring back the method that seems to be the safest and most comfortable for patients.
Well, recovery times in all sorts of surgeries is really an issue sometimes, and we had somebody who I know who had a man who had surgery and on his prostate, and he was off work 2 months. And they would not let him go back to work for 2 months. And I thought, my God, what did they do to you? Rebuild your whole body or what? You know?
Yeah. Prostatectomy for prostate cancers is one of the best applications as far as robotic surgery goes. That really has made a big change for men with regards to surgery. There's certain robotic surgeries with regards to orthopedics that also have really made some great strides and help people recover quicker. And I believe that a lot of it has to do with your ability to recover quicker. There's quite a few people that I have done a V-notes hysterectomy on that haven't taken a single narcotic after surgery. And with the narcotic issue that has happened across the country, and the way that we're able to do this, people just feel better quicker with less need for narcotics.
I think it's interesting because of the big push against using narcotics that so many people can get along without them. Whereas, and they were routinely prescribed Schedule II narcotics, morphines and all other kind of stuff for pain relief for all sorts of surgery, even minor surgery.
Correct.
And it just, so much of it now, like oral surgery, a dentist, whatever, they don't use narcs anymore. They use Tylenols and, and softer pain relieving products, and everything's fine. So I guess that whole section of prescribing narcs in the way it went away, I guess was a good thing.
Yeah, it really has been. We even have quite a few people that undergo C-sections nowadays that I'm able to send home without narcotics at all.
Wow, that's amazing.
Well, Dr. Sherock, why don't you share your contact information and your website so that listeners today can get more information about you and your practice? Because you've covered a lot of topics, and I'm sure there's some interest out there for more.
Well, I really appreciate you guys having me on today, and it's been my pleasure to try to help educate your audience. And that's what I feel we do at my practice, is we just try to educate people and trying to find and partner with them as far as their best way to move forward with their health. We have a website. There's www.myobgynohio.com. We also have another website, www.yourbestkeptsecretaesthetics.com. We can be found on Facebook under myOBGYN Ohio and Your Best Kept Secret Aesthetics. And certainly we are taking new patients all the time. If anybody would like to call the office, my Maslin office phone number is 330-809-0460. And the Orville office is 330-765-9104.
Very interesting. Well, I found it a very interesting program. I'm very happy we had you on. I'd like to have you back again.
I would enjoy that.
Okay. Very interesting what you brought to the table today. Pakovich, I remember him sort of. He'd been gone a while, I guess. So, but he really had something going.
Yeah, he has an interesting story. When he was 65, he was an internal medicine doctor, and he retired from practice. And at that time, his wife was going through a lot of hormonal issues, and he developed this keen interest in bioidentical hormones. So he opened up his practice again only to bioidentical hormone patients, and it really thrived.
Much time we got left, Brad?
I think we're out.
We're out. Okay. Thank you for our guest, Dr. Nick Sherock, with myOBGYN and Your Best Kept Secret Aesthetics. We would like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Altman Health Systems, Studio Arts and Glass, January Appraisals and Liquidations, and he's having a tag sale this weekend. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday, right here on News Talk 1480 WHBC.